Welcome to the Merge Medical 10 for 10 podcast. I'm your host, Dr. Jeff Brown. I'm joined by my co-host, Dr. Jeff Cole, Brant Herman, and Dr. Carolyn Brown, the founders of MouthWatch and Dentistry.One. Welcome, guys.
Thanks for having us.
Brant, I went through your pitch deck. Can you briefly describe the structure between MouthWatch and Dentistry.One? I think I understand that Dentistry.One is a subsidiary newly formed.
Yeah, we formed it last year. MouthWatch has been around for 12 years. We're a leader in the dental hardware space of imaging devices, cameras, and teledentistry SaaS platforms. And then we launched Dentistry.One, where we're actually a DSO, a dental support organization for a nationwide network of practices that are affiliated with us. And then we've built out a specific technology platform for virtual first oral healthcare delivery.
Excellent. And so for our listeners, for clarification, Dr. Brown is the Chief Medical Officer of Dentistry.One, which is the clinical arm of
Correct.
dentistry. Okay, very good. So Dr. Brown, tell us about the problem and the solution that you're addressing.
Well, one of the problems that we know is no matter how you slice it, only about 40% of adults in the United States see a dentist every year. And we know that dental care is really the gateway to the rest of healthcare and to the rest of the body. Mm-hmm. So when people don't have good preventive care or have dental decay and periodontal disease, there's a whole host of other issues that are normally concordant. So this is our opportunity to make dental care accessible for people. They don't have to wait 3 months and fill out 7 pages worth of forms to be able to see a dentist. They don't have to walk into an office with 2 or 3 hours of time set aside to complete the exam. And what we can do really for the dentist is tee them up for a more informed handoff of a patient.
So you have a national network of dentists. How large is that, and how are they invited? Do they pay a fee to join, or what does that look like?
Yeah, so we have a nationwide network of dentists. There's over 400 in our network. There's no fee for them to join. It's all opportunity for them to generate additional revenue through consults that might be live video consultations that are immediate or scheduled, or asynchronous exams. We're working off of photos and a description. You could give a patient some guidance and message back and forth with them about what they might need to help be healthy, get healthy, or stay healthy.
And Jeff, we also credential. That's really how they become a provider for us, is we have a very extensive credentialing and training setup so that we're recruiting high quality dentists who are matched to the types of payors or clients that we're seeing.
Are they credentialed in every state, or what does that look like?
Yeah, well, go ahead, Brant.
Well, we credential them for their background and license validity and expertise, and then we'll enroll them with dental plans where they're in the state where they're licensed. So no matter what state a member or consumer might come to us, we have a dentist available, and it's highly likely we'll be able to accept the insurance that patient has.
And for those listening, if you want to learn more, I encourage you to listen to or watch the deep dive version of this podcast. But I want to talk, and we talked a little bit about this in the deep dive, just walk us through a couple of use cases from a patient perspective. Dr. Brown, if you want to take that one.
Sure. Okay, one use case is you go into your primary care office and you learn that you have type 2 diabetes. As you're walking out of the office, we can text the patient and ask them if they'd like to learn more about the correlation between oral health and their response and journey as a diabetic. They can either choose to look at education, they can reach out, or we can have someone reach out to them through our oral health coaching team, and or we can connect them right then and there to a dentist. So that's one journey that they do have kind of a pick your journey opportunity. And we think that the oral health coaching / care advisor role is really unique. It doesn't sound unique to you on the medical side, because having nursing support, health coaches, patient navigation is become pretty baked into your systems. But really in dentistry, this is pretty novel.
Right.
To have people who can do this. Mm-hmm.
Well, that patient that just went to their PCP and learned about diabetes, how did you know that they were at the office, and where was that connection?
Mm-hmm.
Right.
How did
So
that happen?
there are multiple ways. We're a software company at our heart, Jeff, and so there are multiple ways that we can do that, including the ability to sync into some practice management systems coming pretty soon here. So we could just have a live push.
But you could do more than just chronic care. You talked about some acute issues that people deal with their mouth. You want to talk about that as well?
Sure thing. So someone has pain, instead of going to the emergency room, their dental plan tells them about Dentistry.One. They connect with us and can sync right then and there with the dentist from their phone. It doesn't need to be through an app or through their computer, so that we can either take photos. They can take photos from their phone and upload them. Mm-hmm. There are a lot of things that we can guide our patients through a live video feeds that we can see. And we're working on some other technology that should be coming forward here that allow us to read some of the video and captured images using AI.
And a little bit more to that point, you had told me earlier, 2% of ER visits are dental related, which could be eliminated. Correct. Additionally, 30+% of what patients think are emergencies really are not emergencies when dealing with their mouth. So Dental Watch or Dentistry.One could eliminate all of that cost, correct?
Correct. Which provides, really the patient is then not, driving all over town, spending hours waiting in the emergency room. But we also know that the emergency room care isn't usually conclusive. Oftentimes it's not the right antibiotic prescribed that's ideal, or they're not going home with that particular tooth extracted, so they need to see a dentist in a
because you're not seeing a dentist in the ER anyway, right?
Correct.
Do you have some dentists that are part of your network that do not have a brick and mortar practice? Or
we do.
Okay.
Yeah, we have some who are retired, or they might be working as an associate a couple of days a week in another practice and kind of complementing this.
So are there situations where there are scheduled appointments within some template, or is it more just they're kind of on call for Dentistry.One? How does that work?
It's a little of both. So a dentist in our network can set their schedule of availability, and then we'll know that we can either schedule appointments for them or drive them real-time appointments within that window. And then we also have live video, just immediate. So someone could request it. It would naturally go first to providers if they are scheduled and available, but we can also notify providers and get them just aware that there's an opportunity to see a patient.
And that software platform, is that part of MouthWatch?
That's Dentistry.One's platform we've built in-house. We've not only created what we think is a really great and streamlined experience for asynchronous consults. We're taking photos and getting a oral health report based on that, incorporating the AI, or live video synchronous where you're doing it in real time. People can also get second opinions. They could upload radiographs and treatment plans from another provider. And instead of going to a physical office where they're already going to tell them something that's going to help lead to that patient choosing that provider, we can give an unbiased second opinion where we're looking at what's been presented to the patient, making recommendations, and if they want help finding another doctor, we'll take care of that with our care coordination and support.
Can you talk about your goals with regard to improving access, whether it be Medicaid, small counties with low population, low dentistry access count?
Yeah, 70 million Americans live in health provider shortage areas for dentists. So we want to be that easy virtual first touch point where barriers to care, including anxiety or fear, distance, and cost, we're able to significantly reduce. And, there's definitely no pain from a video consultation. So one is being that first touch point that provides that access and education in a setting that's most comfortable to the patient. And then supporting and collaborating with plans where we find that we can be more effective in referral when practices and groups know what's coming in, and there's a much lower likelihood of that patient canceling or rescheduling because they're teed up. They know if they're going to drive that hour to get to an office, I want to know what I'm going in for. I want to know what's going to happen and know what's going to be my cost. So it's really a much smarter patient journey. And we've seen this proven out in a lot of what we do with our existing teledentistry platform, that when groups are deploying this, they are showing up to that appointment. There's more that's able to get done and less surprise. So you've got kind of a happier patient, a happier practice that all fits in there.
And you'd think that you'd each have to have very unique backgrounds to lead an organization to solve a problem as big as this, mixing dentistry access or lack of access. Can you guys each give us a brief description of your backgrounds? Ladies first, Dr. Brown.
Yeah, so I'm a general dentist by training, and really was at the forefront of alternative modes of dental delivery when I worked for a large FQHC that was a part of the Indian Health Service in the San Francisco Bay Area. And I was a really active grant writer and kept trying to find ways to deliver more care more efficiently and in ways that my patients really, could tolerate. Coming in for a really overwhelming treatment plan was often, difficult for them to envision how they could be successful. So I've kind of been an innovationist, a futurist ever since, but, have really started some companies, been involved and as an investor and an advisor, and I've worked pretty closely strategically with payors. So I also understand some of their lenses. So it was sort of a dream to get to know MouthWatch and Brant and Bob through, one of those payer relations, and really just, really quickly jumped on board because it's the right team solving the right problem at the right time. And, that timing piece is super important.
And what about you, Brant?
Yeah, I'm an entrepreneur at heart. This is my third company. I come from a family of dentists. My father's a dentist. My stepmother's a dentist. And while I knew I couldn't do the clinical or the artistry side of dentistry as well, I definitely saw the need and opportunity to transform care. I think dentistry has been in kind of a lane that needs to connect to medical more, needs to connect to technology that's not chair-side technology. And yeah, went from experience across high-tech companies, .com companies, to health and wellness, and really have found this great spot that I'm passionate about in transforming care, increasing access, meeting patients where they are, and really helping bring dental into the medical system. I think it's still very siloed, and we really want to make sure that since patients kind of bear the benefit of the outcome, payers bear the benefit of the cost savings, we can be a path that really connects these two journeys into one.
That's great. How about competitive advantages and competition?
Yeah, there are a few small competitors out in the space that provide virtual first care. Some of them are synchronous only. Some of them are using off-the-shelf platforms with smaller networks. We're really confident in the size of our network of providers at over 400. Plus, we add services that complement that. We have care coordination, where we're actually booking appointments for members. We have care advisors, so we have hygienists on staff who can support with oral health coaching and a better patient experience that can really just be that initial touch point and ongoing touch point. So sometimes we'll joke we're the dentist you see 363 days a year, not the 2 cleanings that you're getting every 6 months, but kind of we're always available. We're going to support you like a personal assistant and booking appointments for you, or we're going to connect you to a clinician when you need to speak with one.
Sounds like everybody in the world could be a patient of this. What kind of revenue do you anticipate this generating, and where are you at currently?
Yeah, that's what we love about kind of the Medicaid space is I think there's the greatest need for increased access and connection to care, and also the motivation to drive patients into dental visits. So we think that kind of across the board where Medicaid is covering patients, there's a huge opportunity to drive more and more patients into an annual dental visit, which is a metric that most of those plans are being tracked by, a HEDIS metric. With commercial plans, we think there's a lot of people on dental naturally that are covered by dental plans that aren't effective as effective as they could be in emphasizing prevention and innovation. So we want to collaborate with them, really support their network of providers that accept their plan and are looking for new patients, and bring this value to them where, look, we can help engage a larger population and then really route more patients into those practices. So we see it as a win-win. We don't think we're taking any patient out of a practice. We think we're casting a much bigger net to get more patients into those practices and really being smarter about it. Dentistry is going through a staffing shortage challenge where every practice is having a hard time finding staff to meet their need. So we want to make sure that they're as efficient as possible when they are seeing patients for hopefully higher value treatment. And we can be a lot of that touch point. So yeah, I mean, I think look at the population of this country. There's just a significant shortage in access to dental care, effectiveness of preventive care. So with our approach to working with employers, working with carriers, working with healthcare systems, these are big buckets where we know dental is connected to over 60 chronic conditions. There are a ton of ways that we can really invite patients in beyond just, I might have an acute temporary pain that I need a consultation on. I've got a whole bunch of other conditions that on the medical side, you're doing chronic condition coaching and you're connecting me with care. Dental can really help improve that, and we really want to make sure that happens.
On that topic, and we touched on it briefly in the deep dive, but in medicine anyway, there's a growing number of biomarkers for various health conditions. There's ability to predict the future to some degree. AI is pretty exciting in that regard. You mentioned saliva samples. Is that part of your future? Trying to drive that business, maybe identifying cancers before they happen?
Yeah, I mean, it's part of our today too, Jeff, in the sense that we can, drop ship, since MouthWatch is a very effective drop shipper. We can drop ship things like saliva test and or dental products directly to the patient or the member. And the saliva diagnostics are really going, gangbusters. There are a number of different companies. There are some that I think are super promising and have the ability to not only just look for markers for oral cancer, for periodontal disease, for halitosis or bad breath, for diabetes. So we're really, staying very close to this and ready to be able to start to employ this as we're working with a number of different salivary diagnostic companies. I think the best part too, is that we have care advisors and dentists that we can calibrate to what each of these tests show, and that when people get a test result back that they may not understand, they can connect directly back with us. And that's part of what Brant was saying. We're not really building this to just be a one and done. We're not building this to be a disintermediator of the brick and mortar dentist practice. We're really building it to stay on pace with where innovation is going in the speed of, this century.
And you talked a little bit about this already. Clearly, you're not a competitor to current dentists. In fact, you partner with them in a great manner. The patients are your customers in some fashion, but really it's the healthcare plans that are your customers. Can you talk about customer acquisition and how you market that?
Yeah, we go directly to large carriers, dental plans, Medicaid plan administrators, and look to incorporate not only virtual care for, I think, kind of what that pandemic use case was, which was, I have an emergency, I need a consultation, and that's that. Yes, we'll check that box and we'll help you offer that. But we're looking at approaches to member engagement, education, identifying risk categories, and tailoring education, preventive care, and consultations to really get those members to, I think, an improved oral health state, which we know is connected to an improved overall health state. We work with employers through benefits brokers where we can help them be more directly involved in what medical dental integration looks like by working with their most at-risk employee base and connecting them to the benefits that dental care brings in terms of cost savings, There's studies that are thrown around in dental all the time of a diabetic patient who gets regular cleanings is $2,000 less on their medical spend and reimbursement by getting new cleanings. Pregnancy is about $1,500. Cardiovascular health, they know gingivala, like a bacteria in the mouth, has been found in the brains of Alzheimer's patients. So I think healthcare is definitely moving toward a systemic approach where wellness is really appreciated and embraced, cost-saving measure, and prevention is embraced. And typically people do think of dental with prevention if we can get them in. So I think that's where we run a show. What's prevention look like when it's direct to patient and when it's supported by virtual, and also just ease and kind of smooth the entire journey to get more patients into that site for care. We know dentistry is the second highest out-of-pocket expense for the American healthcare consumer. So if we focus on prevention and intercede earlier, we think we can get more patients into practices and also make it more appealing for patients to stay healthy, starting out.
I love where this is. We're moving from, we call it healthcare, but we're moving from sick care to healthcare. Yep. And that's where you guys are at. I love it. Well, guys, I want to thank you for joining us. I think that's a wrap. If I can summarize, MouthWatch Dentistry.One provides a service as a software teledentistry platform, partnering with dentists. MouthWatch Dentistry.One improves access to preventive dental care, diagnoses acute problems, eliminates unnecessary ER visits, misdiagnosed issues, and refers seamlessly those patients who do need care to their appropriate dentists in their physical area. Guys, thanks for joining us.
Thank you so much.
Yeah, really appreciate it.
I'm Dr. Jeff Brown with my co-host, Dr. Jeff Cole, with Dr. Carolyn Brown and Brant Herman for the Merge Medical 10 for 10 podcast. Thanks a bunch.
Thank you all.
Thank you.
Thank you.